Hi, I'm holding senior secondary biology book showing one of two kidneys, and below is showing the layers of renal function, three membranes which are being shown. Today I will discuss the nephrotic syndrome, the basically glomerular injury. The glomeruli is a functional unit of kidney where nephrons are there which further constitute glomeruli as its upper part, and the second layer contains podocytes which are interdigitized. There are basically three layers in the renal system which mark the filtration of blood, called as upper is endothelium, next is epithelium of Bowman's capsule, and the last is basement membrane. Except proteins, all the matter which comes into the renal system with the blood is gets ultrafiltrated about 180 liters per day, but we heard that urine is about 1.5 liters only. So where does all the fluid is gone? So here comes the concept of reabsorption. Now coming to the topmost membrane of the renal system, where the negative charges are being flown. Now with the glomerular injury, we can state that glomeruli starts leakage, and we come across a first patient of glomerular injury where a selective proteinuria is being formed. That is, a protein leakage is there in the urea. Now we come across a more injurious patient, second patient, where though the proteins like albumin, globulin do starts leaking, but he may be having non-selective proteinuria being detected in his blood. Now, with further advancement of the disease, the negative charges we have discussed before floating on the membranes of the renal system, due to the repulsion, due to these negative charges to the proteins which are being repulsed, in this patient also the proteins like albumin, globulin do leak, but the leakage is far more serious. It is far more higher than the first two patients. That is, it's about more than 3.5 grams per day. It may be considered as cutoff value. That is, now the loss is not being compensated fully by the body. Something has to be done by the body. Now we know that besides the renal system, excretion is also done by other organs like liver, sweating glands, lungs which excrete carbon dioxide, and sweat glands secrete waste materials in the form of sweats. Liver generates lipid proteins. So the first contribution comes from the liver to the renal system. That is, liver starts generating protein plasma for renal system, but we found that liver cannot compensate despite contribution of more than 12 grams per day of the lipid proteins. So there is hyperprotelemia developing in the patient. Besides hypoalbuminemia, hypoglobulinemia, that is excess of proteins. Now, why contribution of liver does not compensate the protein loss? Because body is still trying to compensate the loss. Because the reabsorption function, we have discussed before. The the more liver generates the protein plasma, most of them are get reabsorbed by the tubules in the renal system. So with the failure of liver to compensate the loss, now come forwards the circulatory system. Body is still trying to compensate the loss. So we find there is an interstitial fluid generated, or you can say leaked from the capillaries of the circulatory system. That is, hydrostatic pressure is being formed at the arterial end and osmotic pressure is being formed at the venous end of the capillaries. So there will be flow of interstitial fluid because fluid flows from high to low pressure. But in the first two patients, there was a lymphatic system which used to reabsorb the interstitial fluid. But this third patient of glomerular injury with more than 3.5 grams per day, that is the cutoff value is being crossed, here lymphatic system is blocked. And there appears edema on the limbs of the patient. We can find a non-pitting edema on the limbs of the patient. That is, if we touch the edema location of the patient, the pits are not being formed. That is, the interstitial fluid is not being moved. But unlike the first two patients of glomerular injury, there was pitting edema was being formed. Edema was being formed in the first two patients, but it was pitting edema. We can see the motion of the fluid, interstitial fluid, when we touch the edema location of the patient. So with the formation of edema in the circulatory system of the third patient with serious glomerular injury, there starts the sodium ions and water gets retained in the renal system, and with the edema formed in the circulatory system, there is poor circulatory system, poor blood flow. So these sodium and potassium ions and waters which are being retained in the renal system get further adds to edema. So now with the edema in the circulatory system, blood is much more concentrated than the normal human body. So there is hyperosmolarity, that is hyper concentration of ions in the blood. The cycle goes on now with more and more salt and water. are retained, more edema is formed. More edema is formed, more salt and water are retained in the renal system. So now patients develops hyperlipidemia because there was no compensation for the protein and lipids, and so good cholesterol and bad cholesterol now become imbalanced. LDL and HDL. In normal human being, HDL must be higher and LDL must get lower. But here we can see the opposite is being happening. HDL is lowered and LDL is getting higher and higher. So there is chances of coronary heart disease. Lumps are being developed in the circulatory system of the patient with this serious glomerular injury. He will be developing atherosclerosis and the color of blood changes. It becomes more darker and more now bad lipids, bad cholesterol is being generated, which further adds to edema. Now, with much higher edema, that is much higher inflammation, is now in the patient with glomerular injury. So the injury now comes to cellular level. Cells are being affected and there is drastic loss in urine formation and the patient develops the symptoms like dehydration, loss of water, UTI, urinary tract infection, autoimmune diseases. He may be having diabetes, that is, pancreas also gets affected, and he will be having some minor symptoms like insomnia, diarrhea, and which all combine to form a nephrotic syndrome. Now, with more advancement of the disease, because now patient has developed hyperalbuminemia, hyperprotelemia, edema, and injury at cellular level also there, with more and more symptoms appeared, but story doesn't ends here. So now the iron handling system is now shaken. Blood will become more and more concentrated. Protein loss was already there and hyperlipidemia will be there. Now coming to these, the three layers of the renal system: epithelium, endothelium, and basement membrane. They are being shaken because the injury has come to cellular level. So please do hydrate in between and maintain your body with enough fluids to prevent from such hazardous injuries. Now the coming to the advancement of the disease, with more and more seriousness of the disease, we can see that the second membrane, which do ultrafiltration, that is epithelium of Bowman's capsule starts rupturing. So the story doesn't end here also. Patient shows further more serious symptoms like he may suffer from infections because the injury has come to cellular level, and you can see here at this stage person may not die from nephrotic syndrome, but he may die from infections. Further, as the disease advances, there will be lesions in glomeruli, that is, cracks are formed in the basic unit of renal system. Injury is so severe that no more repulsion is now taking place due to negative charges in the renal system, and the patient develops hematuria. Hematuria can be occurred from other diseases, other failures of the human body also, but this is far more serious hematuria found in nephrotic syndrome, and injury is so severe that the RBCs can be seen in a blood test of star shape, and a pale yellow lipid is being floated on a blood test. And now blood clots are being seen stuck in the tubules found in renal system, and there is so much poor blood circulation at this stage, so much reduced urine formation at this stage, though, and patient develops oliguria, that is reduction in urine, and disease becomes more and more advanced. Now the basic function of the renal system gets ruptured, that is the excretion of waste materials, as person has developed besides hyperalbuminemia, hyperglobulinemia, hematuria, oliguria, and other minor symptoms like hypertension, poor circulation. Now the patient seems to develop azotemia. You can see the pathogenic lab reports of the patient at this stage. There are high urea and creatinine levels in the reports, which are being given in the deciliters. And now the stage comes, the person suffers from uremia. At this stage, he or she may be having hypertension and so much high level of systolic blood pressure that more than 200 count can be seen in the patient at this advanced stage. So the patient comes with the hypertension of so much count. You can give the suppression medicines for blood pressure like diuretics and other anti-hypertensive medicines, and it will be only first aid to the patient as the glomerular injury has developed into so much advanced stage that hypertension has gone to so much higher level. at systolic level. So again, with more advancement of the disease, because the disease is still unattended, there is progressive loss of renal function. Now, the patient is said to be having chronic renal failure. That is, a person is recommended hemodialysis. There is a dialysis machine available in medical hospitals with fluids consisting of plasma, and there is dialysis every week of the patient till he gets kidney transplantation, which is the ultimate solution of nephritic syndrome and uremia. And a kidney is made available from one of close relatives or close friends only when a proper match is found. That is, there will be less chances of rejection by the human body, and this transplantation of kidney lasts for 10 to 15 years. So glomerular injury can be so much hazardous. This was the story of nephrotic syndrome. Thanks. Have a nice day. Stay home, stay safe. Thanks.